Hi, I'm Dr. Craig Jonov from Gallery of Cosmetic Surgery here in Lynnwood, Washington, just north of Seattle. So we're here to talk a little bit about, treating deflation or changes for facial rejuvenation that occur in the face. So we have a patient in their early 50s that's here for some rejuvenation. We kind of want to focus on some of these areas that we can have opportunities to improve, to kind of soften the look of aging and kind of give a refreshed look. When we begin to look, we look around the orbital region. She's already had a Botox effect to kind of help soften and smooth the forehead. But we begin to start seeing where there's a little descent of the upper eyelid fold, where a little bit of that tissue is lost. The old ways of kind of correcting this are still some viable, or surgery where that brow lift is done to kind of elevate the tissue. But that tends to somewhat look artificial or operated look, and a more natural look is more about filling in the areas of this area to basically give projection because it has descented. We also like to tighten some of that tissue with other types of procedures to achieve tightness, to reduce the laxity, to give a more natural curve or contour. Some of the areas that we also lose to deflation around the temporal hollow. As one ages, this area loses its subcutaneous tissues and gives a more skeletonized look. So we begin to want to fill that area. As we move around the orbit, around the eye, we notice that it becomes more skeletonized. And so if we want look of youth and age, it has more cushion or support around that area. So we want to selectively be able to elevate that. We have an area that's most common noticed in aging is the tear trough deformity. Usually this is subcutaneous fat or volume that surrounds this area that reduces this groove that begins to occur and translate across the face. So what we want to do is fill that area up so that it softens the effect of seeing our lower fat pads that gives that eye a look of tiredness. So we want to be able to add the tissue volume back into these regions to create fullness and softness. Now, there's has to be kind of just the right amount. We don't want to overdo it and be over contoured. So we want to just softly be able to effectively volumize this area. We begin to look at part of the descent and deflation. It occurs along through the facial regions, through the folds, or what we call the alar groove. So we don't necessarily chase the lines, but we chase the areas above and below the line. We like bigger folds, actually. The lines occur because the volume is lost above and below, and it creates a line. So people tend to want to fill the lines, but actually we want to fill the areas of deficiency. So these are areas that we would look to volumize. The same thing on the corner of the mouth, where we see a progression of this kind of marionette line that goes down into the jawline. So again, it's selective in the ability to kind of fill in this area in the pre-jowl sulcus, we call it, to soften the effect of that, to reduce this jowling look. So this begins to descend or go below the jawline when our goal is to create a nice uniform jawline. We can see that we've lost the border of the lower jaw. And again, this is another area that we want to volumize to give more definition of the neck. So by filling this, it actually lifts the tissue to give it support. And then we also treat the neck by wanting to get some tightening. So the way to tighten skin is either through surgery or from a non-surgical way, as this patient wants to do. We could either use Ulthera, which is a way of ultrasound heating the tissue, or we can do subdermal heating through Cynosure's triplex smart lipo machine. We're going underneath the tissue. We heat the dermis to appropriate temperature to allow for contraction of this skin. And what happens is now we create more of a sharp neckline region. The benefits of this that you get initial improvement, but up to 3 to 6 months continued improvement throughout. So by utilizing the volume to enhance these areas of the pillars of the face, we create structure and support. And then by combining them with some other skin tightening procedures, we increase the tone and reduce the elasticity, and we make the skin more rejuvenated. So combining these procedures together give us our ultimate kind of rejuvenation with multimodalities rather than just a surgical correction. And the idea is that it makes it look natural, refreshing, and lasting. And the benefits too are that then now they can be maintained. So we're getting it combined for a complete rejuvenation and just maintaining maintenance. And maintenance consists of medical grade skincare, such as Skin Medica, Obagi, Epionce. And what happens is it continues to keep regulated the cells that reproduce our skin surface and maintain our pigmentation to keep color correction, which is key to protecting against environmental factors as well as antioxidants. And so by doing that and maintaining that volume, we have a nice, refreshed, natural looking face that will hopefully reduce the need for potential surgery in the future.